Hi, I'm Dr. Regan Tilley, and I just want to take a minute to come on and explain why when someone says, I want a holistic doctor, I want somebody that does functional medicine, and I want to have all of the good things that go along with it because I know that this is what my body needs to heal. I don't want to be on conventional medicines. I don't want to be prescribed another drug. I just want to do things naturally. But that holistic doctor must take insurance. And I have XYZ insurance, and if you don't take it, then I can't see you. What you need to understand is this. The reason that most functional and integrative doctors don't take insurance is because insurance companies do not believe that functional and integrative medicine is real or that it is an experimental process, and they won't cover any of it. You might get a few labs covered. You might get some testing covered that's considered conventional, things like that. But when it comes to gut testing, parasite testing, nutrient level testing, genetic testing, all of that is considered experimental and insurance doesn't cover it. So while you might find a doctor that takes your insurance, that doctor also has to do what insurance says to do. So it's not as simple as just taking my insurance and do what I want or do functional medicine and do holistic practice. There are some practices that are hybrid practices that do cash-based services for certain things and then bill your insurance for the visits and such. They are generally larger practices that have other providers doing other things and they need the insurance to cover it. Or they're part of a larger hospital system that gives the overhead for them. So they're not having to be fully dependent on what insurance reimburses, which is a pittance, to be honest. So you're asking a physician to put in an inordinate amount of time to do a deep dive into your care, write orders for labs that are not covered by insurance, that with a patient that has the mindset that insurance must cover it, you know it's going to be a fight the whole way to get those reimbursed. It can be quite daunting. And so it's really difficult because it's really hard to have it both ways. If your insurance-based doctor deviates from what the insurance company deems as standard of practice, they can be censured. There are also situations where they are unable to teach or educate in certain ways because they are part of a system or part of a group that requires certain things to be discussed and not to be discussed. And so when you seek out a holistic or functional doctor, you're seeking out someone who has taken a chance and stepped out to be an independent entrepreneur in general. So they're running their own business. They are funding their own education. They are trying to provide services at the most affordable cost in general for their patients, and knowing insurance won't pay for it anyway. So I just want to kind of throw that out there, that is why most functional and integrative medicine doctors don't bill insurance, because they know that either insurance will deny it because you don't have a proper ICD-10 code on it, because dysbiosis and gut permeability do not have an ICD-10 code yet. Autoimmune disease related to any number of things, food poisoning. Some of these things were getting recognized, but it's taking a gargantuan effort to get it recognized. Non-celiac gluten sensitivity, it's recognized, but it's not really treatable or coverable for insurance because it's considered just like a functional diagnosis. It's not really a real thing. So what I'm saying is this: if you really want a functional and holistic provider, recognize that your health is an investment and that you are the one that should be making the investment in it. Yes, certainly, most of us will try to use your insurance for any testing that we can get covered, which does happen. In my practice, if you have Medicare, if you have TRICARE, if you have Blue Cross Blue Shield, whatever it is, if there's a test that I know they will cover because of the factual diagnoses codes that I have, I am more than happy to help you submit those to insurance or send you to a lab that will do so. But when it comes to my time and my specialty, we are a non-entity to your insurance company. They won't reimburse us, or they won't reimburse us appropriately. So this is why asking for a holistic minded functional doctor that takes all insurances is really kind of an unreasonable ask. So I'm not trying to call anybody out. What I'm just saying is this is why it's hard to find somebody that does that.